All right. Welcome, everybody. Thank you for your patience. This is the Community Health Webinar Series. My name is Sean Holler, and I'm the new program manager for the Great Plains Good Health and Wellness Program. Very pleased that you're all here with us today. Our topic of discussion is diabetes and COVID, what you need to know. So very exciting stuff. This is stuff happening in the world right now, and it's very pertinent information. So very happy you all could be here with us today. Before I jump in and introduce our speaker, I'd like to take a quick poll. We're going to do two polls, one at the beginning, one at the end. This is just a real quick one, and I'm going to launch it right now. Real simple. It's anonymous, so nobody knows your answers. Feel free to be as truthful as you can. Just want to get kind of like a baseline at the beginning, and then like I say, we'll do another one at the end. Looks like I'm waiting for two more people. Remember, there's no right or wrong answer. Everybody wins. Everybody passes today. All right. So let me go ahead and introduce everyone to our speaker. Today, we get the pleasure of speaking with Susan Barnes. And so Susan is a nurse, and she has been a nurse for quite a long time, since 1985, as a matter of fact. And so she's been a nurse longer than I have been, have made trips around the sun. So it's super exciting to have someone with such vast knowledge and experience. And additionally, Susan, she has been a diabetic educator with Avera Sacred Heart Hospital in Yankton, South Dakota, since 1991. So she has many, many years of experience with diabetes specifically. And she's very, very passionate about diabetes and very knowledgeable in COVID and everything like that. And so we're very happy to have her. And throughout the presentation, if you have any questions or would like any clarity or want to make any comments, we ask that you do so inside the chat. If we don't have time to get to them today, we'll make sure to send a reply with those answers from Susan at the end of this. But again, without further ado, I give you Susan Barnes. Thank you very much.
Thank you, Steve. Thank you for being here. For today, what I would like to do is start with a little bit about COVID, what it is, and a little bit about diabetes and what it is, and then work towards how do you control diabetes in the current environment of a COVID pandemic, and what that means to keep myself healthy or my loved one healthy. Just to kind of let you know, COVID, there's actually 7 different types of coronaviruses, and it can run the gamut from severe Ebola, bird flu, all the way to just the common flu or common cold. So there's a lot of different types of viruses. This one that we're talking about, the novel coronavirus 2019, is new since December 2019. That's the first we've known about it. So that's a fancy way of saying we're learning as we go. It's been a little over a year. We've learned some things, but we got a lot to learn. Tomorrow we may learn some more new things. And sometimes when you get really scared, I want you to stop and think that 50% of the people that get COVID-19 or coronavirus disease 19 have no signs and symptoms. They may not have any problems. What's unusual is I can see some people that I'm really sure this is going to be the person that has lots of problems and that their COVID may be really severe and they get through fine. And I've had other people that are doing fine and didn't think it was going to be much of a problem and they're in the hospital. So we really can't predict, but most people do very well. for coronavirus, the way this particular one spread, what we know is more of a respiratory thing. So this particular coronavirus gets in the nose, the sinuses, the throat, the lungs. And so when you sing real loud, talk real forcefully, cough, sneeze, that virus is in the droplets. And if you don't have your mouth covered, those droplets can go as far as 10 feet away. Those droplets can go on the door handle. If they're on my hand and I touch the phone, that can be on the phone. And so generally it will spread with people that are within 6 feet, especially if people don't have their mouth covered. Some people, you can pick it on if you have a door handle that somebody was just there and you put your hand and then you touch your eyes or your mouth, that droplet, that virus needs to get in your eye or your mouth. So if you're rubbing your eyes and your nose, your mouth, after you touch the door handle, then you can pick it up. There's, it doesn't seem like on things like cardboard that it doesn't live very long there. So when you think about it that way, the best way to protect yourself from COVID is to be 6 feet away. That way, hopefully the droplets are heavy enough, they fall down on the ground and don't reach me. That social distancing, that's really hard when you're talking about your grandkids and your husband and your grandma. 6 feet away is where we want to be. Covering your mouth with a mask, and I'm going to come back to those masks in just a second. If I wear a mask, I'm protecting you. So if I cough and I have droplets, it all stays in the mask and doesn't go. If you're wearing a mask, you're protecting me. It still doesn't protect the eyes though. Washing your hands. Now, one thing that I have seen, because I do work in surveillance for infection control, and I just see it out in public a lot. People wash their hands by getting the tips of their fingers wet and then they kind of dab them and go. That's not washing your hands. Washing hands is getting your soap on the top and the bottom of your hands between the fingers for a full 20 seconds and then rinsing it off. So if I touch my hands on the doorknob or I touched my mask because I had to itch my nose, if I wash my hands with soap and water, that's good. Sometimes we're not near soap and water. Washing your hands or hand hygiene could be alcohol. And it needs to be a 60% alcohol. If you have the alcohol hand sanitizers, you can put a little bit of that in your hand and just rub to get all of the parts of your hands to go through. Now is not the time to go to the bar where the bar's full, to go to the concert, to go indoor eating where you're really close to people, so 6 foot, especially in areas where they would be taking their mask off. If you have people with their mask off, you want to be at least 6 feet away, which is kind of hard because if I'm going to stay home and not be working with other people, that's where a lot of my support comes from visiting with friends and having get-togethers and support groups. So now I'm going to have to adjust to go through. I would suggest one of the ways to kind of protect ourselves outside of the social distancing, I'm not the greatest housekeeper, so this is really hard for me. But every day you really should be washing the phone and the door handles and the areas where your hands touch, the areas in the bathroom, just to protect yourself. Why? Because if you are exposed to COVID, those people that get symptoms may not show symptoms for 2 to 14 days. So I may be passing it around and day 1, 2, 3, and I'm not having symptoms. 50% of the people don't have any symptoms at all. But if I do, probably the most common are loss of taste and smell, fever or chills, cough, fatigue, muscle ache. This is new and unexplained. Sore throat, congestion, runny nose, kind of a sinus thing, diarrhea, vomiting. If I have those symptoms, how do I know if I have influenza or I just always have sinus problems and allergies and maybe it's that? The only way you would know is if you call your doctor or your local health department for your state, like Nebraska that has COVID testing. You call them up, schedule an appointment, you go to that town and get COVID tested, and then you can find out if you're positive or negative right away. probably pretty soon they'll even have home COVID testing that you can do. The COVID testing amounts to having a swab that they put in your nose, and then they take that swab and they put it in water and test the water. It's a special fluid, or they take the swab in a card and put some drops over it. So it's a pretty quick test now for those rapid type of tests. We do want to get tested. If you have symptoms, then we really don't want to be going to work and sharing those symptoms with everybody else unless I know I'm tested. That gets to be pretty rough. If I'm trying to live paycheck to paycheck and make rent, and now I got a cough and a sneeze, and I got to wait a day or two before I get my results, that's 2 days without pay. I didn't say these things are easy, but if we have symptoms, we shouldn't be going out to work or out and about. If we test positive, now this is a little different than people that have had the COVID shot. But if we've been exposed, that we know somebody's positive, or if we have symptoms, we need to stay home until we have 10 to 14 days without symptoms. There's a lot of side things with that get pretty complicated, but I just say the Department of Health, if you're positive, will call you and walk you through things. Those people that have had COVID vaccinations, they may not need to quarantine if they've been exposed. If it's been more than 2 days, they may not need to quarantine. So there's some new stuff coming down the pike. So who's at high risk of COVID? You know, we said there's 50% of the people that don't have any symptoms. Who are the ones that really get sick? Those people that are higher risk are as we get older. The older you are, the less immunity do you have to things. So we're more prone to having the serious side effects. It could be people with any immunocompromised. I'm on cancer therapy, chemotherapy, chronic kidney disease, COPD, a smoker. That's one thing I don't hear very much out in public, but smoking makes you more prone to have bad outcomes. Heart conditions, obesity, whether I'm overweight or just above the BMI of 25, or I'm really obese, I have a BMI above 30, that makes us over risk. But percentage wise, the people that have one of the highest risks are those that have type 2 diabetes. Those with gestational diabetes and type 1, we think they're at higher risk. We just don't have a lot of hard data to say they definitely are at higher risk. I can say those people with diabetes that are in control have more problems than those people that have their diabetes in control. And I want to go back later and talk about what in control means. Okay. So I talked about washing hands, avoiding close contact, cleaning and disinfection. The one thing that for prevention is travel. You know, it's really hard that I'm really bored. It's been over a year and I just want to get away to that beach where nobody's around, but now's not the time to get into an airplane. Even if you're traveling by car, you really have to think about it twice. Do I have food that I'm not going to stop and get gas and be exposed there, or have to go out to eat? We want to isolate where we're not around people. So traveling's pretty tough right now. Later on, as we get more immunizations, we can kind of loosen up on that. As somebody who does infection control surveillance, I want to go back to that mask a little bit. There's certain types of masks that help. If you have a cloth mask, there are ones that have 4 layers to it. Having your bandana from your headband that you put across, or the scarf across your mouth, is not masking. Just lately in the last 2 days, they've been talking about some people wearing 2 masks, where you have a regular your surgical mask on and then put a cloth mask on top. If that helps you, that's great. It does increase. Remember those droplets I was talking about? We want the mask to be thick enough that the droplets don't get through the mask to me. So it stops them at the mask. What I see is several things. Oh, this is a little uncomfortable, so I wear my mask below the nose. It's not helping you if you wear the mask below the nose. If I sneeze, then that sprays everything out. And if somebody else sneezes, I'm breathing it in. It has to be above the nose. I have several people that are fairly small in stature, and if the mask is not the right fit and is too big, they'll try to twist the end of the mask of the earlobe for where it hooks onto the ears, and it bunches up on the side. If you have a big hole on the side or the bottom with airs coming in and out, it's not doing you any good. It needs to fit fairly tight around for the mask. And now think about this for a second. If I'm out at Walmart, I'm out at the grocery store, I did finally meet somebody that had COVID or was there a second ago and sneezed, my mask protects me. So when I breathe that air, it filters out the COVID virus, fairly big virus, so that cloth can do it. But then if I go touch my mask, let it roll around inside my car, on my phone, and wear the same mask for 10 days, I'm just spreading that virus around. So those masks need to be cleaned regularly. If you're going to use a disposable one, that's great. You know, every day, get rid of it. If they get wet, I coughed and sneezed. I'm just working hard and I sweat and I got my mask wet. It needs to be thrown away, even if it's only been 2 hours, and put a fresh one on. If you got a cloth mask that got real wet and I want to reuse, I'm not home, you really should put it in a plastic bag, throw it in your purse or your pocket. If it's throwing it in the car, I just got done grocery shopping, it's not wet or anything, they say put it in a paper bag just so it's not rolling around the car touching everything else. I think some of us are bad at that, but especially about having the mask not fit well. If there's any questions, don't be afraid to keep going. So I talked about COVID a little bit. I want to go into diabetes. There are many, many types of diabetes. By far, it used to be 95%. Now it's about 90% type 2 diabetes. Interesting to me, when I started many years ago, about 4% of the population had diabetes, and we were worried it was a health epidemic. Now, in the area that I'm at, we do have a lot of Native Americans. We're looking at 9%. So there's a huge number of people with type 2. It used to be that people were over 65. We'd call it old age diabetes. Now I'm commonly seeing preteens, 10, 11, 12 years old. 5 years ago, we didn't see that. So a lot of new changes in diabetes as well. When I started years ago, it was kind of like, oh, honey, you have a touch of sugar, don't eat sweets, we'll wait till you have a heart attack and we'll put you on insulin. We really didn't know. We had insulin, one pill, couldn't take real care of it, and it almost felt like a death sentence. So I think people are terrified about it. I'm here to tell you we have many different medications. We know how to take care of it. You can live to a ripe old age with all 10 of your toes and do well with diabetes. You just have to control it along the way. And the way I'm going to talk about this, because we could be here for weeks and just talk about that subject, but to simplify it, I'm going to go through A, B, C, D, E, F, G. A, for advice, don't smoke. With diabetes type 2, your body doesn't use insulin properly. Not your fault, it's hereditary. It comes from genes 20,000 years ago. You can't just blame mom and dad. It goes much further. But when you smoke, you make that problem 10 times worse of the insulin not working well. Your pancreas is supposed to make insulin, but over time, because the beta cells have been working so hard, they die off, and I'm making less and less insulin over time. So we don't want to tax them more by smoking, outside of all the other stuff you hear in the media. Healthy food. You could sit here and talk about healthy food and have discussions that people will argue. Every 5 years, a new diet comes out, the same thing that was out last time, they just put a new name on it. I'll tell you, my philosophy is for 85% of us, we should just eat less of food and have a variety. We don't need so much. 85% of us have malnutrition in the United States. That blew me away. That's 2015 data. And we just eat too much. We weigh too much. So we have malnutrition, but we're eating so many calories. So you should meet with a dietitian and know what carbohydrate is. That's a big fancy word for sugar sitting on the table. But here's a real simplified way of looking at it. If you have a 9-inch plate, half the plate should be non-starchy vegetables. So not peas and corn. Half the plate should be spinach, broccoli, cauliflower, cabbage, fresh tomatoes, green beans, those non-starchy vegetables. 1/4 of your plate should be a protein. That could be beef, pork, chicken. It could be cottage cheese. It could be cheese. 1/4 of the plate, your starch. So that's your spaghetti. That's your baked potato. That's your pasta, your rice, your corn, your peas. Now, I don't know about you, but when I used to go to the Olive Garden, I had a 12-inch plate that was stacked, 5 inches high, and that was a serving size and what I thought was a serving size. Spaghetti is only 1/4 of the plate, about the size of a woman's hand, or maybe a little smaller for some of us that aren't supposed to weigh so much. Now, with that 9-inch plate, there should be an 8-ounce glass of milk or yogurt. And on the other side of the plate, I'd have a 1/2 cup of fruit. So that gives you an idea that I'm going to eat, because my body doesn't use health or food correctly. I need to have less food at one time, but more often. Kind of like a car needing gas. I can't put 1,000 gallons in the gas all at one time in the tank. I need to keep filling it up. So breakfast, dinner, supper, bedtime snack every day. Gave you an idea what the plate would like, no skipping. Depending on the medication that you're on and your lifestyle, you may need a mid-morning snack or mid-afternoon snack, but not everybody. Exercise is part of the advice. And I'm thinking, how do I prevent problems with COVID and diabetes? And then what if I have COVID? Well, I still need to eat whether I'm sick or not. I can't skip the meals. But the better that I eat to keep my blood sugars under control, and next step is what is in control, I can prevent the problems. Well, with exercise for diabetes, the minimum is 150 minutes per day. And that's 150 minutes where I break a sweat. I feel like I'm working at it, but I'm not short of breath. Notice I didn't tell you what to do. For me, don't ask me to golf. I'm not a golfer. I'm not, and maybe you are though. So it's something you enjoy. Now during this COVID pandemic, the adaptation is really hard for me. I don't know about you, but I used to go to a wellness center, and now that I can't go to the wellness center and work out in a group, it really threw me off a loop. I'm here a year later using my home treadmill, but things are still working through. Now, if I do have COVID and I'm seriously ill, I may be on a ventilator, or I may be so short of breath, I'm having a hard time getting dressed for the day. So I'm not going to be out walking 2 miles when I'm that sick. Again, the guideline, don't cause pain, don't get short of breath, but try to do as much as you can. So that's advice. B is blood pressure. The American Diabetes Association gives a target of 140/90. Why in the world would we let it be that high when a normal blood pressure is 120/70? Well, we don't want people, if you're not my 94-year-old mother-in-law, to get dizzy and fall down. That's too low of a blood pressure if you get dizzy and fall down. Now, having said that, I'm talking generalizations. You and your practitioner should have specifics for you. You're not a generalization. Maybe your goal should be 120/70. Maybe my heart doctor or my kidney doctor is saying, yeah, you got to be below 120/70. Well, how are you going to know? I'm in the middle of COVID. I don't really want to go out all these different places, but you should be seeing your doctor for your routine exams. For diabetes type 2 not on insulin, at least every 6 months. If you're on insulin, every 3 months. Please do not skimp. The clinics do have telehealth, where you could look over a phone if you have a computer or Zoom, or a phone that you can do Skype. You can do things that way. But for the clinics now, they have the chairs blocked off, so you have 6 feet off. They're screening everybody on the way in. They're making everybody wear masks. And so when you look at the risk factors of not seeing your doctor regularly versus in this COVID pandemic now going in, you need to go in regularly. Is my blood pressure under control? Some of us may actually need a blood pressure machine at home to check in between. So B is blood pressure. C is cholesterol. Once a year, I need my cholesterol done. Am I eating foods that the fat is liquid at room temperature and not solid at room temperature? That's kind of the short version. I don't need a cup of olive oil on those calories on my salad. That's way too much. But the solid fats are going to have more cholesterol, or those things from the red meats are higher fat. If I'm looking at the food label and it's got more than 10 grams of fat, that's a real high fat item. The diabetes control, the D, here's your A1C. The American Diabetes Association says, you know, am I doing okay? Is the blood pressure control? Is the cholesterol in control? And is that A1C below 7? I'm kind of saying that tongue in cheek because if I'm 94 years old in a nursing home in poor health, maybe below 9 is good enough. If I'm 26-year-old and I'm you know, studying to be a medical doctor, maybe 7's not good enough. I can understand how to control. I have the ability to do blood sugars, maybe 6.5. The research says keep your average below 150. That's the magic number. How you get there is not so important as long as you're not having lows. I can have an A1C really low, but if I'm having 40s and 400s and up and down, that's not good either. I don't want real super highs and real lows. And I know I'm moving kind of fast, but hang in there. We talked about advice with not smoking and exercising, eating healthy. We talked blood pressure, cholesterol. The D is the control of the A1C. These last ones are a little easier. Eyes. Did I get my yearly eye exam? That's important for diabetes and preventing complications. Again, during the pandemic, things were closed down for a while. A lot of us are behind. They are doing the CDC guidelines now, and it's good to go back and get your eyes checked. F, feet. Don't go barefoot. 70% of the people with diabetes have numbness of their feet. You stub your toe on the way to the bathroom at 2 o'clock in the morning, and my toe dies, and now I need a toe amputation. I'm kind of blunt because I'd rather have you never need to come into the hospital in the first place. Prevention. So wearing shoes, looking at your feet every day, and if you're trimming your nails with the shape of the top of the toe, don't get the edge so low that I'm causing ingrown toenails. If you can't get down there, go to a podiatrist and let them trim the toenails. And finally, guardian drugs, we'll call it. Because this insulin resistance is so tied in with high cholesterol, high blood pressure, and people are at high risk of stroke and heart attack. Not all, but most people should be on an aspirin and a statin drug. Your doctor knows that. That's why you go for your yearly physical, to see if all of those things. But they're also going to look at your immunizations. Did you get your flu shot? That's important. Am I up to date with my shingle shot? If you had diabetes, you need to have your pneumonia shot. Usually that's at age 65. If I'm 40 and diagnosed with diabetes, I need it at the time of diagnosis. So there's a lot of things to think about. Your doctor knows all these things, and they can help you work through. So now putting the diabetes and the COVID together, having diabetes doesn't make you more prone to COVID, but those people that have diabetes that's out of control, those A1Cs are above 7, they tend to be the ones that get more ill and not do as well. So good control of your diabetes at the beginning helps protect you. It's worth going to see the doctor. For some reason, more so in men and women, people that are on metformin actually do better. Those people that are on something we call the SGL2, those medications that help you get rid of the sugar through the urine is one of the newer ones, Invokana, Ferragletza, Sclaratro. They can actually, if you get really sick with COVID, can cause something called ketoacidosis. So they're probably going to stop that medication if you're on Invokana and you get sick with COVID. So those are the preventions. I want to talk a little bit about what if I have it. Prepare ahead of time in the first place. By the time I've got a fever of 102 and I'm really tired and I'm coughing, I do not want to run to the pharmacy to go get stuff. So what the heck should I have around? I would say at least a 30-day supply of your medications, maybe not just one vial of insulin, you need 2. If you're sick, you're probably going to be doing blood sugars 4 times a day. Do I have enough test strips and lancets? If my blood sugar is above 140, some doctors will say 150. If you're on insulin, especially, you need to check your urine for ketones. You basically pee in a cup or pee on the stick. If it changes color, I have ketones. That means my body's short on insulin. I'm really sick. I need to call the doctor. I need more insulin. There's no ketones, not so bad. If I'm sick, nauseous, vomiting, I can't keep solid food, I need Gatorade or Pedialyte, maybe regular Jello instead of the sugar-free. Those are the kind of things you put in a sick day box. I always tell people, if you're going to call your doctor, they want specifics. First, your name and birth date. Then they pull up your chart on the computer. Once you have your birth date, you pause a second. Don't say, I have a fever, I feel hot. I want to know the actual temperature. So thermometer. It's really important to stay hydrated. So you should shake your weight every day. If you lose a couple pounds, that's not a good thing. That's water weight, and we're getting dehydrated, getting into trouble. So do I have a scale in the house? And those are the kind of things that you're going to talk to your doctor about. Being specific. What are my blood glucose readings for the last 3 days? What kind of insulin? I don't care if you talk to me an hour ago. I want to know what diabetes medications you're on again and what dose. And be specific on your symptoms, not just that I'm vomiting every hour and can't keep anything down, or I'm just nauseous and kind of a little irpy. Those are two different things. Whoops, sorry, I threw the pen. I would probably say the biggest problem that I'm seeing in this last year is people are scared with COVID and they're second guessing themselves. Should I call my doctor? Should I go into ER? Well, I really don't want to go into ER and get sick because there's sick people there. If you're questioning it, if you've got positive ketones, especially if you're really sick where you're having chest discomfort, chest pain, shortness of breath that's persistent, blue fingers, blue mouth, confusion, go to ER. Don't even waste around. If you're second guessing yourself, go. People are just waiting too long to go, and by then it's harder to treat. Some of the other questions, I'm kind of want to go into a couple questions here. What else can I do if it's my husband that has COVID, my kid, my mom? I'm fine. But my family member, I tested negative, but my husband tested positive. There's a little bit different. I live in the same house. Now what? If your spouse or significant other or whoever lives in the same house is positive, you really need to separate. So they should have their own bedroom, be in their own room. They should hopefully have their own bathroom. That may not always be positive, or ability to do that if I only have one bathroom in the house. If you're in the same room together, you need to be both wearing masks. Washing hands frequently. If they're going in to use the bathroom, they need to wash things down, after they go through in between. No buffet meals. The meals need to be, here's the plate, and not everybody go and grab up what they want. If they're doing blood glucoses, we don't want to be sharing the blood glucose meter. And especially if they get confused, hopefully I know what their medications they're on. So if I need to call the doctor, they're running the temperature, have a confusion or any of those things, I know how to do a blood sugar. I know what medications they're on. Really should have a whole list. And I'm trying to make sure my mom or my grandmother or my mother-in-law has a 2-week supply just in case we really have to isolate from each other, that they don't have to be run into the grocery store. A lot of the grocery stores and pharmacies now deliver. Or if they don't deliver, they have drive-by. You go online or call them and give them the stuff that you need, and you just drive by and pick it up at the window, or they bring it to your window of your car. So there's some ways there to try to isolate, to go through. Hopefully, if you have any questions, don't be afraid to go through. And a little bit here, I want to talk about vaccinations. I just want to double check, going back on the sick day box to make sure I got everything. The thermometer, urine ketone test, broth, Jello, hard candy, your Gatorade, extra insulin. I missed knowing your sliding scale. The reason we have people doing blood sugars every 4 hours is that because I'm sick, I'm under stress, my blood sugars can run higher. And if my blood sugars are running higher, I may temporarily need extra insulin. Well, the doctor or practitioner gives you a list. If your blood sugar is this, take this much extra insulin. That comes from your practitioner. It would be a good idea to have a discussion with them and know ahead of time what my sliding scale is. So if my blood sugar is running high at breakfast, dinner, supper, I try the supplemental insulin to bring my blood sugar down. If I've tried 2 doses of supplemental insulin and my blood sugar is still high, it's time to get on the phone and call the doctor. Again, don't wait too long. We try to do things outside the hospital as much as possible. And I failed to mention we should have medical supplies. Do I have something that to wash the bathroom up on the door handles, whether it's alcohol wipes or Lysol or bleach? Do I have gloves? Do I have masks? Tissues. If somebody's sick, just something as simple as when I have tissues to cough in to go through. Sometimes we forget. Do I have the Motrin or the Tylenol if I have aches and pains, or the cough medicine, the blood pressure kit? Those things kind of have are things I would like to have in that sick day box. So we've been talking about COVID and diabetes, being prepared to prevent if I have it, trying to not give it to everybody else, and take care of myself properly. But one of the things for COVID prevention is the vaccine. I've been helping out here in Nebraska giving the vaccines. We've given about 13,000 shots now. I take that back. If you count the other part of Avera, it's really gone high. I think they're up to 30,000, or we have several hospitals. And I've had some questions. People will ask, well, should I get the vaccine because I don't know if I need it and if it's safe? If you've had COVID, maybe you had symptoms, you were tested, and you can honestly say, I did have it, you still need the vaccine. The getting COVID, they're not really sure, but the newest research says that gives you antibodies to help for about 3 months. And you still can get it a second time. So getting the vaccine, there are 2 that are approved right now, Pfizer and Moderna. They need 2 shots. One, you get it again in 21 days. One, you get it again in 28 days. They have gone through peer review and testing and have an emergency approval with the FDA has gone through. They are safe. No, there's not a chip in it to the government to follow you. I've actually had people scared about that. I've had people worried about the side effects. If you have had severe reactions, like I stopped breathing or I can't breathe well, from another type of vaccine, usually it's from polyethylene. If you're allergic to that, you have no business getting the COVID shot. People that have had another vaccine the 2 weeks before cannot get the COVID. We don't want to try to figure out what side effects are from. So if you haven't had your flu shot yet and you're up to getting the COVID, get your COVID shot first, then work on getting your flu shot, because you can't get anything for 14 days. As far as side effects, 50% of the people roughly have none from it. It's more side effects than the influenza shot, but not as bad as the shingles shot. Those people that get it tend to be the younger people. The older people tend not have less. Why? Because we have a stronger immune system when we're younger. The more robust response immunity, the better we like it. Those people that get a sore arm and get fatigue and achy joints, that's a good thing. That means you're having a good immune response. So most people just, the second shot is usually worse than the first shot, but it's just a real good sore arm for a day. Most people have nothing. About 15% of the people may have a little bit more than a sore arm. So that's a good number, but it's not everybody. Really, those things, again, aren't anything to be worried about. If I had a temperature above 100.1, I was having difficulty breathing, that needs to be reported to the doctor. We tend to be overcautious. So the way it goes with the COVID vaccination, we're still in the nation working to getting enough supply. So they're starting with the high risk. We've worked at healthcare providers, EMTs, nursing home people, and most states are now giving the people over age 80 their shots that are not in a nursing home. The end of this week, we're already working on people that are over 75. Next week, we'll be looking at people over 65 and that have other side effects. Most departments of health got the list from clinics. Here, the doctor gave the list. Here's the people that are highest priority who I want to get the shot. But each state is different. After this, they'll give you a website if you don't know. But if you go to the Department of Health Center Disease Control for your state, they will show where you could sign up. You go, there's this, each county has their own way of handling it. So in your state of Nebraska or South Dakota, you go to your county, you put in all your information, and when it's your turn, they call you and they schedule it. You come in and you go through a list of questions. Have you had another immunization? Do you have any allergies? If you're pregnant, yes, most people should get it. After they go through that, you get signed up, you get your shot, and then they make you wait at least 15 minutes to make sure you don't have a reaction. And then from that point on, they schedule your second shot right away. There are two more vaccines, AstraZeneca and Johnson & Johnson. Johnson & Johnson in the middle of February will probably be approved. AstraZeneca probably in March. Johnson & Johnson, what's cool about that one is you only need one shot. AstraZeneca, you'll need two. Pfizer is 95% effective. Moderna's 94% effective. AstraZeneca is 70% effective in the newest research, and Johnson & Johnson is 66. So these new ones aren't quite as effective, but heck, anything over 50% is great. Remember, this is a worldwide pandemic. It's not just the United States. So when we're talking giving shots, everybody in the entire world is trying to get, this is not a few people that we're trying to get all the shots to. I would guess here in an extra couple months when they have enough vaccines in production, they'll just be giving it to everybody. Just recently, starting this Friday, I believe already, a lot of the Walmarts, CVS's, Hy-Vees, and there's select ones in certain areas, especially rural areas, you know, how those are a little bit harder hit. How do you get to those areas? They will be able to be giving immunizations. So there's different phases that they're working with the most critical people first that need the shot and working our way to the whole public. That's really making some people nervous. I'm getting a lot of questions. Why am I get called? When's my turn? So if you go online, you can kind of see the different labels for the different levels, I should say, how they have who gets vaccinated first and what phase they're having. But they're working as fast as they can to get everybody going.
Here's Susan. There was a good question here. It says, what about lactating mothers? Is it safe for the baby if the mother gets a vaccination?
The newest instructions from the Center of Disease Control is that pregnancy is one of those risk factors for COVID of not more risk for serious outcome, being those people that would be at higher risk. They don't completely understand that. So it's something definitely I would talk with the doctor first. But yes, I've had several pregnant people. When you come in for the injection, we actually consult. But I would highly suggest, once you've approved with your doctor, to get that immunization. We do give the immunization for COVID to the pregnant people. It brought up to who else shouldn't have the shot. Really, it's not only the people that have had allergies in the past to the polyethylene, but just recently, if you have had a reaction of Guillain-Barré, that is something that you should talk to your doctor first before you get the shot. They may preclude you from getting the COVID-19 shot. If you've had a reaction to the flu shot and got Guillain-Barré, it's like 1 out of 2 million, but there are people out there that have had Guillain-Barré due to an immunization. Other questions?
That was the only one I've seen.
Oh, great. Hopefully there's some more coming up here. lot of this information, the Center of Disease Control has good information. The American Diabetes Association has very good information. A couple of things that I didn't hit, just thinking through. For COVID vaccination, those people that are veterans, the VA, if you get your health care through a VA, the VA is giving the shots to everybody that's a veteran. And certainly, you know, there's IHS, if you have health care through there, when they're working through, especially in rural areas, it's going to be certain areas that they get through, that you can get your vaccination there. I've had people say, well, if I've had the COVID-19 and I've had both shots, can I go see my grandkids now? That's the whole purpose of doing this. I don't want to be isolated and I haven't hugged my grandkids for a full year. We're still learning a lot. We don't know how long the shot's going to give us immunity. They really think it may be years, kind of like the hepatitis shots that you may not be able to test it in the blood to see the immunity in the blood, but if you get hepatitis after they're getting the series of shots, your immune response has something called a memory. The T cells are fight, and so those hepatitis series of shots protect you. They think the COVID shots will protect you from this virus. We don't know if it'll be a year that we have to do it every year. We're hoping it's going to be maybe a booster years down the line. But that doesn't mean you can't get COVID. Forgive my poor grammar. So you may get a real mild case. It protects you, but I may get a mild case and be able to give it to grandma or to the other kids. So for right now, even if you have the COVID shots, we still don't have what we call herd immunity. So you would still need to wear a mask when you go out. You still don't want to be hugging grandkids or getting close. Herd immunity means about 80% of the people in the area have had the virus and have immunity, or they've gotten the shots. Hopefully we get a lot of people getting the shots. That's really important, because I think there's some people that are scared or still don't believe that COVID is realistic. It is. Believe me, we've seen it. It's really heartbreaking to see the people on the ventilator and working their way there, and they're still saying that COVID is not true. It's really hard for us. So fully vaccinated people, you may not have to quarantine if you've had an exposure, but if you have symptoms, you're still wearing your mask when you're out and about. I've had the question, what about if I'm under 16? We still don't have the data for the COVID vaccinations that it's safe for under 16. So no, we're not giving it to people under age 16 at this point. They have several studies. They want to get at least 20,000 people and study it before they're going to allow it for people that are under 16. That does concern me, and I'll tell you why. Coronavirus vaccine can mutate like any virus, even just like the flu virus, but we have seen 4 mutations right now. The original coronavirus that we've seen in 2019, we're getting better at treating it, but I'm just going to say 4% people really having problems. And I mean, it can has a certain number of people, or certain percentage of people that can get it if you're exposed, the percentage of people exposed that get it. These new ones are more contagious, maybe not more, and more deadly, about the same people, but it's more contagious. So if you think of a state in the day that the original one, 100 people get it, but the second one is more contagious, and the one from Britain, now we're getting like 40 states already have it. Instead of 100 people, we have 1,000 people get it because it's more contagious. Well, if it's 4% of 100, 4% of 1,000, two different deal. Of those, it's still overwhelming the system. Most states, I won't say all, are really seeing a downward trend. But if you get exposed, remember the symptoms don't show up for 2 to 14 days. We really don't start seeing hospitalizations until like the 5th, 6th week. So we don't know how many Super Bowl parties were there, and what's going to happen with that. We still want to get the social distancing. And there's still Texas, Arizona, North Carolina that we're seeing more of these variances, and those areas really have an uptick of coronavirus. The coronavirus lives in a host, and the way it keeps alive is I cough, sneeze, and get another host, and then it goes from that host to another one. And as long as we have that process, we're going to keep having the coronavirus. I think we've always had these kind of things. In the 50s, we had polio. We've had the swine flu in the 1918. We've had Ebola like 5 years ago, was it? I don't know exactly the year. This is just tending to be more contagious. So it may be something like polio or smallpox that's just not going away. We learn to live with it, but we want to stop the spread with the masks and the distancing, stop the host, and hopefully get it to die out, or to be something that we can get immunizations that the kids take a shot. And after they do that, then they're protected through their life, like we do with shingles now. I'm old enough, I didn't get the shingles shot. You have to be born after age 1980. But we're still working, and this is all fairly new. Other questions so far?
Yeah, we've got about 8 minutes. So anybody that has a question, COVID or diabetes specific, now would be the time.
While you guys are working that, I might talk about medications. I've had a lot of people that think if they're on insulin, that makes them worse off, or if they're on more than one medication. I'm sorry to say, I think the healthcare profession kind of causes a lot of this. If you come in to see me, what's the first thing we do? We ask you 3,000 questions, and it's kind of like you feel like you get like a, I always say the impression is this caveman with the bully club saying, shape up or I'm going to put you on insulin. Insulin's a natural hormone. It's not a bad thing. Either your body's making it or it's not. Are your blood sugars running on average below 150? To get to that average, I have to have ADA says blood sugars before meals 80 to 130. College of Endocrinologist says keep it below 110. After meals, 2 hours after, below 140. So if my blood sugars aren't there, I'm doing blood sugars at home. I don't just throw it in the drawer and forget about it. I actually do something about it, call my doctor and say, what are we going to do about this? And if we generally start with metformin first after diet and exercise, giving you 3 months for that. Then we'll use metformin first. And recently now, the second thing is incretin hormone. Incretin hormone is a natural hormone that usually tells our body to make insulin. And for some reason with type 2, we're missing it. And you can get that in a once a week shot. What's cool about it though, you don't gain weight. Matter of fact, a lot of people lose weight on that. So we tend to go to that medication second. We like to use the medications that are cheaper, not the ones that are thousands of dollars, please. Metformin's like $4 a month. Incretin hormone, it really varies on which one, but maybe 250, 400 bucks, but covered by insurance. We tend not to use the sulfonylureas. Those are the third generation glipizide, Amaryl, because they stimulate the body to make insulin. But if my beta cells are 70% dead and only 30% living, I don't want to kill off those 30% in theory faster. So we don't use that as often. We tend to go more towards insulin next. So if my body's not making insulin, I can be on insulin. If my body's not using insulin right, then it's metformin. Missing incretin hormone, I can be on a shot of incretin hormone. There is a pill that's not quite the same, like Januvia. Those DPP-4 inhibitors help my body keep the insulin it has. It doesn't work quite as well as the shots, but it is a get incretin hormone. And then those SGLT2s help me get rid of insulin by urinating it out, lowering the renal threshold, they call it. Those have really shown to lower blood pressure too, and be really good to lower chances of heart disease. So the message there is there's many medications. I want to use the ones that are affordable on my insurance formulary. I want to use those things that actually work and keep my blood A1C down below 7. And then I have less problems. I'm not going to say you don't have any problems. In our business, we can't guarantee you'll never have a health problem ever in your whole life. but you decrease your chances. There's a diabetes control and complications trial that was done like 28, 30 years ago, and they followed people for 26 years and still some now. There's a United Kingdom prospective diabetes trial, and it asks the question, if you keep your diabetes under control, does it help? 98% less problems with diabetic eye disease. And we have new meds since then, so that's probably low. 76% less problems with kidney disease. So the message there is, just like anything, if you take care of yourself, you can stay healthy. This is not the end of the world. Pretty overwhelming at first, and you probably won't believe me for a while, but then it ends up being like the silver lining. I'm being forced to take care of myself and be healthier. I thought I was going to live forever. And you can have diabetes and be healthy at the same time. That, I don't think most people have gotten that message yet.
Right. That's a powerful message. I think I'm really happy that you brought that up, Susan. That's important. It's important to let people know that they have the power, and it's not like the disease controls them. They have the power to control the disease.
Very much so.
Maybe that's even a bad way to put it, but
well, it's good. The only thing I'd be a little careful, at least I try to be, although I've failed miserably many times. Don't feel, be cautious of that you have compassion for yourself. As a person with diabetes, I think it's easy to be judgmental or feel that your healthcare provider may be judgmental. They have all of these different things. Susan gives you 70,000 things to do, and I'm so overwhelmed. Pick one. Baby steps, and be compassionate to yourself. We tend not to be kind to ourselves like we should be.
Right. That's a very good point. Looks like we got about 3 minutes left. I'm going to throw up our last poll before we finish. And hopefully everybody can take that poll real quick. And if you have any other questions for Susan, please include them in the chat, or you can always email the Great Plains Good Health and Wellness team. We'll make sure to get those to her, and we'll include those responses in our email response to this community health webinar series. Yeah, if there's anything else, I've got a very nice presentation. Thank you very much, Susan. So we appreciate everybody for being here. Thank you so much for your time. Thank you, Susan. As a nurse, I'm sure we all understand that you guys are swamped right now. You are very much in need. And so you spending the time with us is wonderful. We very much thank you for that. Let's see. Yeah, if anybody has anything else, like I say, feel free to let us know. But thank you for your time, everybody. We'll see you next time. And again, thank you, Susan. Really appreciate your knowledge and all your experience and all your great tips. A lot of great stuff here.
Well, it takes a village. Thank you, everyone, for everything that you do. We all work together, and that's how we win.
That's right. Better together. Better together. Oh, unfortunately, one of the questions is if we will receive a certificate. Actually, unfortunately, no. This is not. We are not certified to provide continued education credits or anything like that for this particular webinar. However, that is something that has been brought up a couple of times. So I'm going to look into. We'll look into that for the future of this community health webinar series. Thank you for that, Nicole. Other than that, I got a lot of awesome, well done. Thank you. Good job. Thank yous. So appreciate everybody for coming. Again, thank you very much, Susan. It's very nice to have you with us. Thank you for all your knowledge and shares. And I think that's it for the time being.
Thank you. You guys have a great day.
All right. You too. Stay warm.
Yes.